Welcome to Charing Cross 2024. My name is Dittmar Bőckler, one of the co-chairs of the symposium. I'm glad that you listen and watching our video today. With me is Dr. Schermerhorn, Marc Schermerhorn from Boston, Massachusetts in United States, and next to me is Andrew Holden. Both don't need further introduction, but they're experts in the field for vascular care, for AAA care, and they have a lot of experience, meanwhile, with sac embolisation technique, and that's why we're here, and we want to listen to your opinion today. So, Dr. Schermerhorn, you presented about the AAA Pivotal Randomized Control Trial. Can you tell us and the audience, can you explain why preemptive AAA sac embolisation makes sense and is needed?
Yeah, there's a significant unmet need because more than half of our EVAR patients have failure to regress after the implantation. And that puts them at increased risk for reinterventions, for rupture, and a higher mortality. So any way that we can increase that sac regression rate will lead to better outcomes for all of our patients.
So there's a new polymer, SHAPE polymer out there. Dr. Holden, can you tell us more about this?
Yeah, just as Marc was saying, for a long time we've been interested in this active sac management to try and shift a lot of the patients who either got stable sacs or growing sacs into a shrinking sacs because, as Marc said, that is associated with increased patient survival. And our standard management of embolizing branches, I know Marc will talk about that, has some problems. So we were very attracted to the SHAPE memory polymer. It's a polyurethane foam. It has a high surface area, and we know that it resorbs with time. We felt that the very structure of the product would lead to sac shrinkage.
Okay. Marc, I heard that you have a lot of experience as well. Does the embolic material matter in your opinion?
Yeah, I think it does. I mean, you can have success with coils. You can get a decrease in type 2 endoleak, and you can have improved sac shrinkage with coils, but then you have all of this metal in there and all of this artifact that really makes it hard to follow these patients with CT. It makes it really hard for me to tell if they have an endoleak. And then if you have to reintervene, having all those coils in the way really makes it hard to navigate through that area and know what you're doing. So with the SHAPE memory polymer, you don't have that. You have great visibility.
Andrew, Dr. Holden, as we move from the AAA-SHAPE early feasibility studies now to a new trial, the pivotal trial, what do you think will learn from that?
Well, the SHAPE memory first in human trial was really quite successful. Remember, it was really designed to confirm safety and see if we could see an efficacy sign. So that was 35 patients in the Netherlands and in New Zealand that had active sac treatment with SHAPE memory. And we saw that at 1 year there'd been a sac shrinkage of 6 millimeters or a sac diameter or a sac volume shrinkage of around 29%. This is a very encouraging efficacy, but we're really trying to, going forward, establish what is the role of this in routine practice. So there is the need for a trial to compare standard of care, that is EVAR without active sac management, to SHAPE memory assisted active sac management with EVAR.
Marc, you're also an expert in conducting trials and getting evidence from registries. What is your thought and your future perspective on this device and this embolic agent?
The registries have certainly helped us to know that sac shrinkage is really important and has that survival advantage, but really the highest level of evidence is a randomized trial. And so we really want to know how much benefit is there. And so in this trial, we're going to randomize 180 patients at up to 50 sites in New Zealand, the U.S., and in Europe. And we'll have a primary efficacy outcome of the percentage of patients who have at least 10% volume reduction at 1 year without any reinterventions to that point. But we will have follow-up out through 5 years. There'll be clinical follow-up, imaging follow-up with a core lab, and they'll also be looking at healthcare utilization. So there will be some increased costs at the initial procedure, but it will hopefully decrease reinterventions, decrease the need for as much extra surveillance that you often see when you need a reintervention or when there's sac expansion or endoleaks that we're not sure about. So we're really hoping that it can improve all of those aspects. And also we're looking at quality of life. I think there's some patient anxiety that goes along with knowing they have an endo leak and their sac is not shrinking or it's expanding. And so we can really potentially have a big impact on all of those areas.
So thank you very much for sharing your experience and your visions on this new device, and we look forward for the trials you're going to conduct that really will add some evidence to the care of our patients. Thank you very much.
Thanks, Dittmar.